Good morning, everyone. Welcome. We are going to give it just a couple minutes before we get started. But thank you so much for joining us this morning. Welcome, everyone. Thank you for joining. We're going to give it just a couple minutes before we go ahead and get started. We want to make sure everyone has a moment or two to get through the traffic and to their computers before we get started this morning. So appreciate your patience and glad that you're here with us today. Welcome again, everyone. We're just going to give it another minute before we go ahead and get started. I know the weather was bad, and so we want to make sure folks have their coffee and are ready to get started in just a couple minutes. We have over 200 people registered for this event this morning, and we want to make sure we have as many here as possible before we get started. So we will get started in just a minute. Good morning, everyone. Thank you so much for joining. We'll get started in just about 30 seconds, just letting folks join. Okay, good morning, everyone. Thank you so much for joining us this morning for the SAPHE 2.0 Coalition and Campaign launch. We're so pleased to have you with us. My name is Christina Kamani. I am the Assistant Policy Director for the Massachusetts Public Health Association, and we are helping to coordinate this effort. I wanted to first welcome you all and thank you so much for joining us this morning. You know, over the past several months, I've had the pleasure of working very closely with so many local public health leaders, many from the Coalition for Local Public Health, as well as different local boards of health all around the state. And, you know, I think that unfortunately, COVID-19 crisis really points out, you know, the these inefficiencies are in our local health system in Massachusetts. One of the reasons we are here today. I'm just so grateful for the work of so many leaders at the local and national level for tireless effort and advocate for the local public health system. So we are here today to talk about the statewide Accelerated Public Health for Every Community Act, legislation that is going to be filed later today by State Representative Hannah Kane, State Representative Denise Garlick, and Senator Joe Comerford. And we could not be more appreciative of their support. I've had the pleasure of working with them over the last several months and several weeks, and they have just listened so intently to both their constituents, to local health leaders, and to additional partners, and really have heard the need for change in our local public health system. We know that our residents and our communities deserve a certain level of public health protections, and we want to work through this legislation and through working with partners across the state to make sure that those protections are accessible to all residents and all communities. And so we are so glad that you're here to join us today and to learn more about this legislation and this important effort. And we hope that if you are not already excited to be involved, that you will be excited to be involved in this effort by the end of this speaking event today. I also wanted to thank a few more people for joining us today. We really appreciate the Attorney General for her support of the local public health system and for her staff for joining today. I'd also like to take a moment to thank members of the Special Commission on Local and Regional Health, where a lot of this work started several years ago. Eileen McEnany from the Mass Taxpayers Foundation is here with us today. Laura Kitras from the Berkshire Regional Planning Commission. Sorry, getting my cheat sheet. Ed Cosgrove from the Needham Board of Health is with us as well, was on the Special Commission. Cheryl Sabara from the Mass Association of Health Boards, and Steve Ward. So thank you so much. And for those, any of you that I did not mention, we appreciate you being here with us, and we appreciate the work that you did to lay some of the groundwork for being here today. I know that we also have several legislators who are joining us, including Rep. Kim Ferguson, and there are several other staff and others who plan to join us as well. So thank you for being here. Now I want to turn it over to our first speaker and Senate lead for the statewide Accelerated Public Health for Every Community Act, and that is Senator Joe Comerford. So thank you so much, Senator, for your leadership, and we welcome you to speak.
Thanks so much, Christina. Thanks for your leadership and organizing. Good morning, everyone. Welcome, and thank you to everyone who is joining this important launch. We have known for many years, as Christina well said, about the acute needs of our local public health system. Understaffed, underfunded, too many independent jurisdictions, not enough supported collaboration, no uniform system for collecting data, a stressed workforce, and uneven training. The Special Commission on Local and Regional Public Health carefully studied this issue over several years before COVID-19. Their conclusions were a stark wake-up call for all of us. First, many Massachusetts cities and towns are unable to meet the statutory requirements, and even more lack the capacity to meet rigorous national public health standards. And second, funding for local public health is inconsistent and inequitable in its ability to meet the needs of a 21st century local public health system. And then we got hit by COVID-19, arguably the worst pandemic in a century. And against all odds, local public health officials worked valiantly and swung into action, but they didn't have the tools they needed. They didn't have the infrastructure they need and deserve to support them. Well, we're moving into the post-COVID-19 world now, in a world where the COVID-19 pandemic has placed previously unheard of burdens on our local health systems and exposed a chasm of inequities. COVID made clear for all of us what the Commission found over a year earlier. Our local public health system must be strengthened. The bill we're introducing today is a responsible, ethical way forward. It will give us the opportunity to take concrete, effective, short and long-term action and steps so that we are prepared for the next healthcare crisis. There's no question that this will require additional investment. We currently spend a small fraction on public health to keep people well compared to what we spend on taking care of people once they're ill. And we have to remember that local public health is our front line in keeping people healthy in the first place. I'm honored to be one of the sponsors of this bill. My thanks to Senate President Karen Spilka, Chair Michael Rodrigues, and Senators Cindy Friedman and Julian Cyr for their healthcare leadership in the Senate. And thanks to Senator Jason Lewis for his longtime commitment to public health. Thanks especially to the Massachusetts Public Health Association for spearheading this effort, and my esteemed legislative partners, Representative Hannah Kane and Vice Chair Denise Garlick, and the powerful coalition of public health experts who we have assembled this morning. I need to single out Phoebe Walker, Director of Community Services at the Franklin Regional Council of Governments, who has been especially instrumental in galvanizing my constituents' voices and in helping me understand the critical importance of this issue. And now I'd like to turn it over to one of my partners in this and many other good things, the tireless Representative Hannah Kane.
Thank you, Joe, and good morning, all. I'm so pleased to be here with you. I want to start by thanking the Mass Public Health Association for their incredible advocacy for public health and their organizational skill to bring this coalition together. I'm also thrilled to be able to partner with two of my close legislative colleagues, Senator Joe Comerford and Rep. Denise Garlick, who are exceptional legislators and leaders, caring colleagues, and vital advocates for public health. The Special Commission on Local and Regional Public Health was created by a legislative resolve in 2016, wisely filed by Rep. Garlick. I was honored to serve on that commission as the designee of the minority leader. The commission's strength was the knowledge and committed members who represented all facets of the public health system in the Commonwealth. All of us resolved to work diligently and collaboratively to fulfill our mission. And after 2 years of work in the spring of 2019, we produced a blueprint for public health excellence that was unanimously recommended. The commission was tasked with assessing the efficiency and effectiveness of the municipal and regional public health systems in our state, and to propose solutions that would afford each resident of the Commonwealth with the services they need to live a healthy life, regardless of their zip code, income, or the size of their community. The findings of the commission were not a surprise to any of you. Our existing state model is unique and severely antiquated. It is not wholly equitable, efficient, or effective. In fact, there are inconsistent services offered across municipalities due to inadequate funding, inconsistent reporting of mandated data, smaller towns struggling to provide even basic services, a wide variability in staff credentials, and an insufficient pipeline of new workforce members. And the efforts to share services is proceeding slowly. The reality is that most people in the Commonwealth do not think about our public health services. We don't see public health officials inspecting our restaurants we eat at or camps our children attend, but we expect them to do so. We don't see them planning for the flu season or triple E or the outbreak of a virus, but we expect them to have a plan to implement if needed. We rely on our public health services, but they're largely invisible to us unless there is a crisis. And now we have a crisis. Enter stage left, the devastating and unfortunately illustrative example needed to galvanize people, COVID-19. But at that time, when we were commission members, we knew we needed to devise a blueprint that outlined where we needed to go in a way that acknowledged a path people would be willing to take. Our state has a long and proud tradition of local control, and that combined with the lack of a visual way to illustrate to everyone the importance of public health meant that we needed a multi-step plan where each step built on the success of the last one. In keeping with the Commission's findings and recommendations, the SAPHE 1.0 legislation, unanimously passed by both houses in the legislature and signed into law by the governor just 5 months ago, began to tackle many of the financial and operational burdens municipalities face, and to afford communities and residents, regardless of region and socioeconomic demographics, with a greater and more equal opportunity to access vital public health resources. The legislation had three components. It ensured that all members of the local and regional public health workforce had access to essential training. It created the SAFE program, an incentive planning and implementation grant program to support more effective and efficient delivery of services, which I personally know from Shrewsbury being one of the 7 member communities of the Central Mass Regional Health Alliance, where we share services across municipal boundaries in a much more efficient and effective way. And I'm thrilled that our town manager, Kevin Mitzigar, is a co-chair of this new coalition, and he will be speaking later this hour. Finally, the legislation that we passed would move Massachusetts towards standards for a 21st public health system. And while this legislation as a whole provided a roadmap to address many of the Commonwealth's public health challenges, the reality is that given the pandemic's ability to both visualize and make real for all people the critical role of public health and the devastating outcome when it's not adequately structured, staffed, or financed to meet large-scale public health challenges, it is clear to all of us now that we need to accelerate our work. We cannot move slowly and build. We must devise and implement a plan to ensure that we have an equitable and effective local and regional public health system. Which leads us to SAPHE 2.0. The pandemic has laid bare to all the inequities that many of us had already realized existed. And it's important to note that these inequities were not formed during this pandemic, but in all the days leading to it. And as I said in my earlier comments, the Massachusetts decentralized model has led to inadequate and inconsistent public health protections. And our state is one of the only to not provide dedicated state funding to local health departments. That is why this coalition is critical, and your support and advocacy for the pillars of this bill are essential. This legislation will direct DPH to establish minimum public health standards and lay out a clear timeline for communities to reach those standards. It will increase our capacity and effectiveness by incentivizing communities to share public health services. It will create a uniform data and reporting system so we can measure and monitor statewide. And it will provide a sustainable state funding for planning, technical assistance, and ongoing sustainable operations. I'm confident that with your support, we can accelerate our movement to a more equitable and effective public health system. I want to thank again MPHA, especially Christina and Maddie. And I'm also so happy to see so many of my colleagues from the Special Commission on the Zoom, and I look forward to working together again to advance this legislation. And I would be remiss if I did not also acknowledge and thank all of you who work in our local, regional, and statewide public health services. Your work makes a tremendous difference in the quality of life and the health of residents in the Commonwealth, and we want to help make it easier. And now it's my honor to introduce my good friend and colleague with lived public health experience, who I'm honored to work together with again on co-filing in the House SAPHE 2.0, a leader who had the foresight to get us all on this path in 2016 when she successfully filed the resolve for the Special Commission, Vice Chair of Ways and Means, Rep. Denise Garlick.
Good morning to everyone. I'm very pleased to be here with you. I want to thank Representative Hannah Kane for her. So good morning to everyone. I want to thank Representative Hannah Kane for her kind introduction, and I wanted to speak just briefly. We all know that public health is not a partisan issue. I hope that people realize in the partnership that Representative Kane and I have in the House of Representatives that we are modeling that every day for our colleagues and for our communities as well. And I want to say a special hello to Senator Comerford, and I'm so pleased to be working with her on this important issue as we've continued to work through COVID-19 on a variety of issues together. And I want to have a special shout out to Ed Cosgrove, who I know is on this Zoom. Ed has been my dedicated and steadfast designee to the commission, and I thank him for his work. But I mostly want to give a real shout out to all of you who are the unsung heroes and heroines of the COVID-19 time. I'm a registered nurse, and I'm a former elected member of the Needham Board of Health, where I served for 2 terms, 6 years. And I know how very important it is that we continue our work in advancing the knowledge that we have about public health and why we need to support this infrastructure. Both the Senator and Representative Kane have talked about the pathway from the commission to the passage of the SAFE 1.0 Act. With the support of Speaker DeLeo and Chair Aaron Michalowicz, we actually funded many of the recommendations from the SAFE Act at $500,000 in the last budget. And I'm going to speak a little bit about budget in a few moments, but we have continued on this path. I congratulate MPHA for their energy and their ability to bring us all together, to give us a legislative tool that's very important for us for a variety of reasons. I represent 3 towns, and I think in my mind, it's almost a microcosm of the issues we are trying to address. I represent the town of Needham, which has a strong health department, experienced staff, well-resourced. I represent the town of Dover, which has a very activist volunteer board that is trying to straining to understand all of the roles that it could play, and certainly bearing the responsibility of the many decisions that are being made in COVID-19. And I represent the town of Medfield, also has a volunteer board, does not have the resources it needs, and feels overwhelmingly the burden of the many demands that are being placed on it. When I think of the goals of this bill, it is to strengthen all of these models, not just in the areas that I represent, but right across our Commonwealth, the 351 cities and towns. Why is it important? Certainly, Representative Kane has talked to us about the what if is in the bill, and Senator Comerford has set the table for us on how we begin this work. But I wanted to talk to you about your own role as advocates, and what the goal of this bill is it gives us a tool to have the kinds of conversations we need to have, both at the local level and at the state level. And it gives us a place at the table as we come into these really difficult budget times. You all know that we have yet to settle the close out the FY20 budget. We are beginning revenue hearings again on the FY21 budget, and we have great concern about what FY22 will be. To have this legislation now gives us the ability to talk about our principles, talk about why this is necessary, and to talk about how public health is the infrastructure of the safety net for our communities. And public health can develop the synergy that will make all of our towns and all of our cities stronger. So the importance of this conversation today and the launch of this legislation at this moment is to give ourselves the vehicle on both policy and budget to have meaningful conversations now, to speak about what we have done so effectively in public health, to talk about our strengths and to talk about the areas that need to be strengthened. I look forward to this presentation today. I too want to listen and learn, and I want to do the work that we will do together to advocate for both the principles, policy, and the budget needs enshrined in this legislation.
Great. Thank you so much, Representative Garlick and Representative Kane and Senator Comerford for leading this effort. We so appreciate your leadership and just your acknowledgement of, the need for this bill, especially in this moment in time. I also just wanted to take a moment to thank some of your colleagues who have joined us today and that we hope will continue to be supporters of this legislation and these efforts moving forward. So I'd like to thank Senator Joan Lovely, Rep. Mindy Dome, Rep. Lippert Garabedian, Senator Mike Moore, Senator Becca Rausch, Senator Jamie Eldridge, Rep. David LeBeau, and then also staff who have joined for House Chairman of the Public Health Committee, John Mahoney. So thank you all so much for joining us today, and we look forward to continuing to work with you all in the future on this. So I'd like to take a moment to just point out a couple logistics. Please keep an eye on your chat. We are continuing to chat out resources that you may find helpful in order to learn more about this bill and these efforts moving forward. And if you haven't gotten jazzed up already about joining this coalition, I hope you will by the end of this, but we'll also be sharing links where you can formally sign on as a coalition member to the SAPHE 2.0 coalition, or if you'd like to join and just stay in the loop as an individual supporter, there's a way for you to sign on and get email updates and action alerts from us as well. So we hope that you will join us in this effort. So I'd like to take a moment to introduce and transition to our co-chairs, whom I welcome you all to join me on our virtual stage here. So as we're putting this coalition together, we know that there are just so many different types of communities in Massachusetts, both rural and urban, gateway cities, and at all varying levels of readiness to increase public health standards in their communities. And so we wanted to make sure we had great and broad representation from a variety of leaders across the state. We are joined here today by 5 of our 7 co-chairs. I'm going to let each of our co-chairs introduce themselves as they speak. And I just want to call out 2 of our co-chairs who are not able to be with us today. Ruth Morey, she is the president of the Mass Association of Public Health Nurses. We know public health nurses are critical to our local public health efforts, and especially during this COVID-19 pandemic. And also Phoebe Walker, who is the Director of Community Services for the Franklin Regional Council of Governments and runs a health district in Franklin County. We are so appreciative of our co-chairs for stepping up and leading this effort, and I so look forward to hearing what they have to say. So I'm going to turn it over to our first speaker, Damone Chaplin from the City of New Bedford. Damone, let's make sure we got you unmuted. There we go.
Thank you, Christina. Hello, on behalf of Mayor John Mitchell and the City of New Bedford, I'd like to say good morning. My name is Damone Chaplin, and I'm the Health Director for the City of New Bedford Health Department and an MPHA board member. Today we are here to listen, to learn, and to take action to improve a public health system which has historically failed to protect its most vulnerable populations, particularly those living in our communities of color. Today marks the first step towards rebuilding a public health system which has historically underperformed, underprotected, and undermined the integrity of our regulatory processes. And although the 2019 American Health Rankings ranks Massachusetts as the second healthiest state in the nation, we are still seeing cities and towns hit hardest in Massachusetts as those that are home to communities of color, including African American and Latinx residents. These communities have long been among the lowest in resources and highest in poor health outcomes. Structural disparities like funding, staffing, and training among local health departments not only affect our rural communities, but also affect many of our larger cities. The link between race and positive COVID-19 cases in larger cities has never been clearer. Gateway cities like Lawrence, Chelsea, Lynn, Brockton, Holyoke, and Revere stand out with some of the state's highest rates of coronavirus. Even in communities like New Bedford, where we have seen a steady increase in our Caribbean and Latinx community, we have also seen a corresponding disproportionate increase in coronavirus-related illnesses. The COVID-19 pandemic was a wake-up call for all of us, as we witnessed a flailing public health system stretch beyond its capacity to respond, react, and resolve critical public health emergencies, including but not limited to comprehensive data sharing, inter and intra-governmental communication, and access to quality health care. In closing, I would like to urge you to consider supporting the SAPHE 2.0 bill, which will support the development of core public health practices and the needs of all Massachusetts residents, neighborhoods, and communities. We have an opportunity to change the quantity and quality of life for Massachusetts residents by supporting an act to accelerate the equity and effectiveness of our local and regional public health system and fulfill core public health services necessary to keep our neighborhoods healthy and safe. So in closing, solving these health equities are at the core of our requests for public health reform in Massachusetts. Thank you.
Good morning, everyone, and thank you all for taking the time to listen to this and for your leadership, and thank you. My name is Sigal Reese. I am the president of the Massachusetts Health Officers Association and also the public health director for the town of Norwood. Over the past several months, we have seen the remarkable hard work of our local public health workforce, and we've also seen the ineffectiveness of the structure in which we are working in. They and the residents of the Commonwealth deserve better. Local health departments are the agents on the ground implementing prevention strategies. COVID has shined a light on these efforts, but local health officials are always working to prevent disease in our community from ensuring a safe food supply to substance use prevention and infectious disease control. There are huge gaps in these capabilities between communities, which only exacerbate the equity concerns with COVID, other infectious diseases, and public health services. This is about strategically adding capabilities to fill these gaps, in some circumstances through shared services. We're looking to add to local health in an efficient way that improves the system. There have been many attempts to solve this difficult issue, but I feel like we are at a point where we can't ignore the existing gaps anymore. We need to supply municipalities with the tools to advance local public health across the state and ensure basic public health protections for all our residents.
Good morning. My name is Kevin Sweet. I'm the Town Administrator and Director of Emergency Management for the Town of Rentham, and honored to serve as co-chair for this coalition. My local government career started nearly 2 decades ago in public health, including serving as Director of Public Health. Throughout this time, I've been involved as an executive committee member of the Massachusetts Health Officers Association, a local state advisory committee member, co-chair of the Region 4A Emergency Preparedness Coalition, served on several committees of the National Association of County and City Health Officials and the National Environmental Health Association. Today, as a municipal manager, I continue to be a staunch advocate for local public health on a variety of platforms. Over the last 10 years or so, having been personally involved in the H1N1 pandemic and failed attempted regionalization efforts, various health district formation discussions, and today, the COVID-19 global pandemic, it is clear our local public health system is not adequate. Local public health has been on the front lines and unfortunately often underrepresented and uncelebrated. I'm stepping up today to contribute to these very important coalition efforts and excited to support the SAPHE 2.0 Act, recognizing it is time for the Commonwealth to establish the necessary minimum public health standards for our communities and provide for dedicated funding to support the sustainability of local public health. Investing in public health is more important than ever. Thank you to all of you for participating.
Hi, my name is Amy Petrovsky, and I'm the Health Director for the town of East Longmeadow. I've worked in various public health roles since 2008, but regardless of what opportunities I've tried, local public health keeps pulling me back in. It pulls me back in because there's something special about having your hand in it, being on the front line, seeing the results of our work, advocating for and being part of a community where our job is to ensure a basic need, health, is fought for and protected for all people. The crisis we are in right now has really put a magnifying glass over a problem that has existed for decades in this field. It has made clear the challenges that people working in local public health face as a condition of our job that really isn't necessary. In Massachusetts, the governor, through his special commission, started trying to identify and solve these problems years ago. But this pandemic has shown those outside the field what we have been saying for years. We can do better, and we should do better, but we need help. I'm equally excited and grateful that Senator Comerford and Representative Kane and Garlick have put forward a bill that not only works to strengthen the delivery of local public health services, but also improve the equity and the way these services reach the residents of Massachusetts and the efficiency and the way these services are delivered. So thank you all for coming today. We look forward to your support, and I appreciate the opportunity to.
Good morning, everyone. My name is Kevin Mizikar, and I'm the town manager of the town of Shrewsbury. I was also a member, and a very proud member, of the Special Commission for Local and Regional Public Health, who set a public health blueprint for us all to follow, and I look forward to continuing on that path today with all of you. The town of Shrewsbury participates in the Central Mass Regional Public Health Alliance, a cross-jurisdictional sharing entity which is one of the hallmarks of the blueprint for public health. We look forward to working with other communities to build on the success stories of the Central Mass region in helping to improve efficiencies and effectiveness of public health. SAFE 2.0 is just plain old good government. It sets the framework for a comprehensive strategy for public health leaders in the Commonwealth, filling the void where there is currently only a patchwork. COVID-19 should be the last public health battle that we fight without a strategically focused and properly trained brigade in place to do so. The Special Commission fulfilled its charge. SAFE 2.0 is the clear next step. Thank you to Representative Kane, Representative Garlick, and Senator Comerford for your leadership in getting us into the next step in the future of public health for the Commonwealth of Massachusetts.
Great. Thank you so much to our co-chairs for your stepping up and for your leadership, working on the ground and then somehow also, making time to lead this statewide effort to improve our local public health system. So we just so appreciate all of you. I also just want to thank a couple more legislators who have joined us, Rep. Kim Ferguson as well as Rep. Natalie Blaze. Thank you so much, and we hope you will continue to join us in this effort. I want to turn it back over to our legislative leaders who are going to talk to you a little bit about just how important it is to be involved in this effort and how you can be involved in this effort moving forward. So I'll turn it back over to you all.
Sure. Senator Comerford, do you want to start?
I'm happy to, but then I'll quickly pass it over. So it's been said, and I'll just underscore, that the legislature works best when we are bolstered and strengthened by advocates with lived experience on the ground, by constituents who care deeply about an issue and help us prioritize it. It's the true tenet of democracy that it should be, in its healthiest form, in its most effective form, people powered. And so when you're the people power behind this coalition, the brain trust, if you will, the heart, and the urgency, we act better on your behalf. There is no doubt in my mind that this is true. It was true for me before I entered the legislature, and in my first 18 months in office. It is absolutely true. The legislature needs you to do our very, very best work. So you're getting involved in this bill at this point with the leadership of the coalition that you've heard from today is the very strongest and best thing you can do to ensure a strengthened local public health system. And with that, I'm going to pass the baton to you, Hannah.
Thank you, Joe. Joe, as always, is eloquent and on point. And I would just simply add that the real opportunity for you all is to share examples of this inequity and inadequacy in your own communities. It's incredibly important to tell stories, to give examples, because stories and examples imprint on us in a way differently than just simply throwing facts and figures at us do. It allows us to really see what the problem is on the ground. And I think it's also critical to note in all of the conversations that you have as part of your advocacy work, that this didn't just come to light because of COVID-19. COVID-19 shone a very bright light, unfortunately, on what we have all seen as the inequities on the ground for years. And so, you know, you certainly should give examples of how COVID-19 has impacted your community, but I would also talk about many other examples that you have where clearly having inadequate funding, inadequate training, inadequate credentialing of the workforce has led to issues that are detrimental to public health. I also think that if you do live in a community where you are part of a shared district, it's really important to talk about the benefit of that and to illustrate how effective that can be. Again, I know that from having been in Shrewsbury, when the difference between when we were a standalone community and what we could provide for services to our residents versus now being one of the 7 members with Worcester, the city of Worcester in the lead of a shared services district. We have access and the benefit of so many additional services that we just could not do on our own. So not only is it more effective, it's also more cost efficient for us. We're spending largely the same amount of money to get a much broader wealth of services than that we could provide on our own. So again, you know, just tell your stories and don't take no for an answer. You know, call colleagues, certainly talk to their staff. Staff is fabulous, but also request a Zoom meeting, an opportunity to, you know, see each other face to face and to have a conversation. And I know that you'll all be powerful advocates for the work that we need to do. So with that, I'll turn it over to our own internal powerful advocate, Rep. Garlick.
Hi. So I have some thoughts that I just wanted to share with you. I think one of the most important things that I have learned in my time as a legislator, and certainly in all the years that I was an advocate around nursing issues, is that it's just not enough to be right? We know that we're fully grounded in what we need for public health in our Commonwealth and in building this infrastructure through the SAPHE 1.0 bill and now the SAPHE 2.0 bill. But it's just not enough to be right. We have to actually figure out how to have these conversations And while we are all a team, legislation is a piece of what we're trying to do. The other members of the team are each and every single one of you and the strength that you have in your local communities. So when I talked about the legislation being a vehicle for us, I'm hoping very much that you feel like your conversations are not only with legislators around this piece of legislation, but in your own community to use these principles and to use these examples, as Representative Kane said, of your story, and engage with the governing bodies, whether it's a select board or it's a city council. Go to the warrant committee, to the finance committee. Speak about what you have done in public health, what you can do if you can have the right amount of support, and your ability to engage with other communities that have strengths that can be shared. And as we enter this time, it's going to be very difficult, and because I am the vice chair of Ways and Means, I keep returning to this idea of budget, but budget is actually embedded in the legislation that we are proposing, right? That you are right about what we need to do, but we don't want to be righteous about it because there are so many competing needs. And I think the best way we can approach this in our communities and in our districts and with the legislature as a whole writ large is that we talk about the strengths that we bring, the synergy we develop. When you strengthen public health in the local community, you strengthen the entire community. When you strengthen one community, you strengthen the entire Commonwealth. And I believe that we can make the case of how important it is to strengthen the infrastructure and resources for public health, not only for the principles that we are trying to achieve, but to strengthen and make more healthy our whole Commonwealth. I believe that you can carry this message better than anyone, and I know with my colleagues, we will lift up this message in every possible place that we can.
Thank you so much again to our legislative leads, and I hope you will heed their call to action. It's going to take every one of us and more, to get this done, and it is just so critically important. I think you are all here because you know that, and we hope you'll continue to stay involved. I just want to reference there's over 200 participants today, and so we thank you all so much for joining. We are going to take a few moments to take some press questions. So these will just be questions from press. If you have a question, please use the raise your hand feature, and we will work to get you on and unmuted so that you can ask your question. For other participants who have questions, my contact information is on the bottom of the fact sheet that has been chatted out, and we'll make sure to also include that. So please feel free to reach out to me with any additional questions. And we hope you will all continue to join us in these efforts moving forward. So I welcome the other panelists to put your videos back on. And then Maddie from MPHA is going to help us to bring some press in for a couple of questions before we wrap up. Okay, so we'll just give us folks a couple more seconds for you to find the raise your hand function. I know we will all be Zoom experts by the end of this pandemic. I was joking earlier that the issue is going to come when we all come back in person and we no longer know how to interact with each other without a screen in front of us. So we do have a question that was chatted in. Is there a bill number yet? So not yet. We'll be sure to send that around. The bill is being filed later today in both the House and the Senate. And so we can be sure to make sure that that information is spread widely once there is a bill number. Okay, thank you, Steph, for the question. Okay. Okay, all right, well, I just want to reference that we did chat out the press release. We've also sent that around. There's a phone number and email address on that press release. So if you do have additional questions, please feel free to reach out to me and I can then filter to the right point of contact. Great. Okay. So we don't seem to have any coming in. I want to just take a moment to thank everyone who has joined us today, all of our lead sponsors, all the legislators and staff who are present, all of our co-chairs. I also would like to make a shout out to the Coalition for Local Public Health. They've really been the true leaders, advocating every day, weekends, holidays throughout this pandemic, you know, for all of you who work in the local health system, and we really couldn't have done this without all of their help. So I just want to let you all know that there are multiple opportunities to stay involved, to stay informed of this effort. Please feel free to reach out to me if you have any specific questions. Please click the links and add yourself on as a coalition member or an individual supporter. You will be hearing from me after the bill is filed. We'll put out an action alert that has all the information you need. I think there's really two important things that you need to do. You know we can't do it alone. 200 people is a great number of people, and that is a terrific start. But I would say number one, be sure to share this with your networks. Share it with your colleagues. You know, talk to, like Rep. Garlick just said, talk to your select board members, your town managers, your city managers, your city councilors. Share this information. Talk about the importance of the local public health system and why this matters and why the time is now to take action. And also make a second phone call or email. Call your state representative, call your state senator, let them know about this bill, educate them about these issues and what's happening on the ground in your community for the constituents that they represent, and ask them to co-sponsor this bill and join us in this effort. We are truly going to need everyone to push this forward, and I know that we'll have your support. You'll have the support of MPHA and all of the co-chairs and your lead legislative sponsors. We're in this together, and I know that together we can push forward and make improvements to our local public health system so that everyone in Massachusetts has access to the essential public health protections that they deserve. So thank you again so much for being here today. We so appreciate your time. I hope there's not too much traffic getting home, and you will be hearing from us shortly with additional next steps and actions. So thank you all so much for joining. Take care.